therapy, and finding what works for you and your circumstances can often come down to trying various methods with a professional you trust. Accelerated resolution therapy, also known as ART, is a unique form that seems to be working for many patients. And here to tell us more, we welcome licensed mental health counselor and basic certified accelerated resolution therapist, Cherish Smith. Thank you so much for being here.
Thank you so much for having me.
It's a mouthful. I'm glad that you bring it down to ART.
Yes, it's much easier to say art.
Yes. So what is this? What is it doing? I feel like I've seen people maybe put it into their biographies or their bios when we're looking for therapists, saying that they have this kind of therapy, but I don't know if I've ever really learned that much about it.
Yeah, and it's growing to become more known. So accelerated resolution therapy, or ART, is a brief and structured form of psychotherapy that really helps reduce distress tied to difficult experiences or memories. So a lot of people think of it as a trauma therapy, but what it does, it helps the brain reprocess troubling images, emotions, or sensations that are tied to those experiences or memories, and it really helps reduce that distress, so then the intensity of it is eliminated.
The first thing that comes to mind is PTSD. Is that a condition that you would use a therapy like this to help people deal with?
Yeah, absolutely. And ART has also been shown to help with a variety of different issues, so not just post-traumatic stress or trauma-related symptoms, but panic, anxiety, depression. The list goes on with phobias, grief and loss, sleep problems. So
pretty much everything that everyone's dealing with. So how does it work?
So it works through a process called memory reconsolidation. Essentially what that is, it's helping the brain change the way memories are stored, especially those painful memories. So using eye movements and guided imagery, you replace those negative images with new, calmer, positive ones.
Interesting. Okay, so what do you mean about using eye movement? Would you show a different image?
So yeah, a therapist would guide you through eye movements, helping your eyes move side to side, while helping you focus using visualization exercises to focus on specific images or emotions or sensations, and then help you transform those.
Okay, so we go in, we discuss with you that this is the best action for us to take to try to eliminate anything that we're going through. What does a typical session look like?
Yeah, so typically a session is like 60 minutes long or so, and you sit comfortably with the trained therapist who will guide you through sets of those eye movements side to side. And it can be done virtually or in person, and depending on the therapist, what they use as a tool, so to speak, usually it's the hand, just following the therapist's hand. And that's where they'll have you focus on either images, sensations, or emotions.
I mean, this seems like it could get pretty intense because you're, and correct me if I'm wrong, but you are bringing up images that are very traumatic to you and that elicit a lot of emotion, and having to actually deal with them right in the minute. How long does something like this take, and how do you deal with it if you're in the thick of it and you start to spiral down and be consumed by what you're seeing?
That's a great question. So what makes ART different than other many evidence-based trauma therapies like EMDR, prolonged exposure, or cognitive processing therapy, which can take several months of sessions and can be very triggering. ART is different because it's a very structured protocol that it follows, allowing change to happen in fewer sessions, often within 1 to 5 sessions.
Wow.
And surprisingly, it avoids prolonged reliving the trauma or telling the details of it. So clients often report that it's actually very calming and relaxing, and it really gives them a sense of control in session.
And healing. Wow, and we all want to be calm and relaxed.
Oh yeah.
Definitely something you should talk to your therapist about, maybe having an option. Thank you so much for coming and sharing this. It's so interesting to learn all the different ways that we can heal.
Thank you so much for having me. I'm so glad I could share more info.
Of course, and you can find more on art therapy at bloomtampabay.com.